Hey, what's up, guys? It's Ali at Integrated NCLEX. I was just browsing yesterday and just got a couple questions from some students, and then they were asking me about Parkinson disease. We went on YouTube and we went to look at some of the resources out there for NCLEX, and they're so complicated and they're so long, and they wanted me to make a quick and dirty video. So here we go. Let's jump into it. So Parkinson's disease. What do you need to know about it? Basically, what you need to know about it, I'll put it into purple color there for you to know about it. So it's a movement disorder. Usually, some studies, like I read, it says that older males are affected more so than the female, and the onset age is like 60. So if you get a questions like, say, 65-year-old male with all the symptoms, so that's the reason why I put the sex and the age of the person. So it's very important when you do your questions, you should look at the sex, age, and race. And those things are very important for you guys to pay notice to. So I always put that into my notes, so you guys have to pay attention to those things. So what can cause Parkinson's disease? Basically, is unknown, idiopathic. So God knows. And the other thing that can cause Parkinson's, basically, it won't be called Parkinson's disease. Then it's going to be Parkinson's syndrome, because it's being caused by secondary to something else. So it can be caused by your typical antipsychotics. It could be like haloperidol. By the way, haloperidol was another side effect. What should you be watching for that? You should be watching for QT prolongation. So QT prolongation can turn into torsades de pointe. So you should be careful about those things. So you can kill somebody by giving them haldol and then increase your QT prolongation. So you should try to integrate all your knowledge together. Try to think about those things. And metoclopramide, you use that for antiemetics. So you use that for anti-nausea, valproic acid for seizures, and lithium, bipolar. So lithium should not be given to pregnant ladies, because it can cause some cardiac abnormalities in the fetus. So it's a big no-no. I can be very fancy and tell you that there's damage to the basal ganglia structure. Some part of it is called like substantia nigra, and there's a pars compacta that's actually being affected. But guess what? You're not a medical student. They won't be asking you those things. Just for completion's sake, I just put it on the slide here. So, but all you need to know is the depletion of dopamine in there. So there's damaged part of the brain of the basal ganglia, and there's a depletion of dopamine. Hence the reason why you get all those symptoms. Okay, let's jump into those symptoms. So this is a picture I took from Wikipedia. This is a typical picture. If you look at these things, if you study pictures with pictures, and you annotate your pictures, you will remember those more so than words. So I would suggest for you guys to use more pictures when you study. So here you go. So what can they have? Mask-like faces. I usually call them as poker face there. Okay, so we have no expression. So being good poker players. Stoop posture, look at that, stooped. And with forward tilt of the trunk, so the tilted of the trunk there is forward, so the center of gravity is offset. So this person at high risk for fall, they're when they stooped and the trunk is forward tilted. And we have bradykinesia. What is bradykinesia? You should look at the word brady, means slow. Kinesia means movement, so slow movement. Okay, so we have also muscle rigidity, shuffling gait. Look at this. The gait is very narrow, and we just kind of shuffle when we walk around. Okay, you can also look at the elbow. The elbow is nicely flexed, tucked in. The knees also flexed. So put them at high risk for fall there. So we can ask you a question about fall. Make sure there is no rug and everything. If you're in the hospital, make sure everything is close by for this person. So follow all the fall risk for fall protocols there. We also have something called resting tremor. So they also call it pill rolling tremor. I don't like that term, pill rolling. So it's just not like they're holding their pills all day and it's rolling. So I don't like that term, but what can you do? That's in the exam. We will ask you. Maybe it will be one of the buzzword in your exam. Pill rolling tremor. So also it's a resting tremor. So, but the only thing is, like, as soon as they move, you ask them to be moving around, do something, a voluntary movement, that tremor will be gone. But guess what? The tremor will get worse when we are stressed. We're high stressed. It will come back, and it'll be even worse. So these tremors can be going from your hands, lips, face, and your lips, jaw, and then to your legs. Also, it can be doing that. Lots of those patients are depressed. Lots of depressions. And then dementia is the last late findings. So these people will end up having dementia in the end. Okay, so these are the your typical picture for Parkinson's disease anyway. So if you look at this picture, and then you can look at those words, and you can actually you can take those words and attach it to those pictures. It will actually be very helpful for you. So you just look at the picture, you will remember it. So as long as you don't overload the pictures, you will remember it. But just look from top to bottom: poker face, tube, tilted, flexed, shuffling gait, muscle rigidity, resting tremors. So, and then depression and dementia, the last things. Okay. So I can tell you a lot about treatment. There are a lot of treatments, first-line treatment, if depend on the age, less than 60 and greater than 65, 60. Actually 65. We use different drugs. So we will use a non-ergot dopamine drugs. But guess what? They will not be asking those questions because the mechanism of actions, you're not a medical student, we won't want to ask you those questions. It's a bit more complex. Questions that we'll be asking you be anticholinergic or your levodopa-carbidopa. So why anticholinergic? Anticholinergic, you guys need to know this. It goes into everything. Every subject with anticholinergic drugs, so you need to know those properties. So those anticholinergic drugs used for this one, for Parkinson's disease, is benztropine, trihexyphenidyl. That's the one we use. Mostly people complaining about their resting tremors, so we get those drugs. So now 65-year-old male with resting tremor also have BPH, benign prostate hyperplasia. Do you give anticholinergic? So you have to think twice before you give that because it can cause urinary retention. Or an older person who has glaucoma. So would you give an anticholinergic drugs? Probably not. And remember, anticholinergic drugs are going to cause dry mouth, constipations. So you have to get them to increase the amount of water, increase bulk fiber intake, and for the dry mouth, non-sugar sweets or candy or gum, you can actually give them. So these are the things you should know about anticholinergic. But most of your question will be coming from like your levodopa-carbidopa. So like I put it there, levodopa actually is broken down into your dopamine in the brain. So remember, there's a depletion of dopamine. That's what causes those symptoms. So you want to replenish the dopamine. So this is the reason why you have levodopa. Unfortunately, if you take levodopa by itself, your body's gonna digest it. There's some part of your body before it goes to the brain, we're gonna end up digesting it, and your body will get rid of it. So the reason why you have carbidopa basically is your bodyguard. So the bodyguard for levodopa is carbidopa. So carbidopa will actually protect levodopa until it goes to the brain, and then will convert into dopamine. So what does levodopa and carbidopa does? It helps with your bradykinesia, your tremor, your rigidity. But guess what? It does not help with your memory at all. So remember, late finding is dementia. So it doesn't help with the dementia. So consideration for taking this drug is it should be taken like on a low dose and then gradually increase. and also should not be taken with food. Usually you should take it in between meal, 30 minutes or 1 hour after meal, because it binds protein. So if you bind protein, you get rid of the drug, so the drug is useless in your body. Side effects, you should know those side effects. Orthostatic hypotensions. So we're going to tell you increased risk for fall. We're going to instruct the person to change position, to slowly change a position. It can cause some neuropsychiatric disturbances, confusion, hallucination, agitation, delusion, psychosis. So I haven't seen those, but it's actually mentioned. Also can cause a kinetic crisis. What it is complete loss of movement if you stop taking the medication. So people who are not adhering or to the meds, and or they forget to take the medications, or they lost the medications, and probably these guys went fishing or went to the cabin for the summer and they forgot the medication at home, and so that can happen, a kinetic crisis. The other one is dyskinesia. So this one can be used like it will progress, it will get worse as you take levodopa-carbidopa. So in order to prevent that, they take this drug, amantadine. So amantadine is also an antiviral, so it can actually be used to reduce the dyskinesia. All right, so I hope that makes sense for you guys. It's not too complicated, but I think these are the key points where we will be asking questions on Parkinson's. So depletion of the dopamine, the presentations, risk for falls, and the pharmacology, the anticholinergic and the levodopa-carbidopa. Okay, if you guys have any question, just post it down below. If you have any suggestions for more videos, just also post it down. If you like this video, give it a thumbs up, subscribe, and share the content with your colleagues. Until next time, have a good one.